to the retail pharmacy program. There were 9 stores, as you know, that were announced yesterday. This was a situation where we contacted CVS, asked for a call, and we told them we would like to put them in our high SVI counties. And we were really pleased that they were excited to do that. They were very cooperative, and so CVS is going to be administering vaccine in Camden, Evergreen, Greensboro, Bayou La Batre, Jackson, Alabama, Lynette, Moulton, Tuskegee, and Union Springs. So the CVSs in those locations are all going to be part of the federal program. Remember, they get a federal allotment that's not part of our state allotment for that. We are still working to make up for the weather delays that we had last week. We worked with McKesson every day, all day, every day, to make sure that everyone gets caught up. I think all of last week's shipments have been shipped. You know, makes a little bit of a delay for the shipments that should have otherwise come this week, but we're gradually working that out. Our county health departments are rescheduling people as quickly as possible. I just want to remind the public again that we have good data that if you're waiting on a second dose, waiting up to 6 weeks is not going to impair your ability to have a good immune response. So even though you may have supposed to have received it this week, up to 6 weeks will be perfectly okay. If you remember the mass vaccination clinics we had in 8 sites or the first part of this month, or maybe the end of last month, we have 6 of those are doing second dose clinics the week of March 1st through 5th. The 6 Pfizer sites will be doing second dose clinics March 1st through 5th. The other 2 Moderna sites will have mass vax clinics the next week for second doses. Let's see. I wanted to mention to you the UK variant. We still have a number of those cases that have been identified in the state. We have this number says 22. I believe that number is a little bit higher. In fact, right now I think we had some more identified last night. This is going to be an issue around the country. As you know, I think most health authorities expect this will be the dominant strain in the country very soon, you know, probably by the end of March. And so we are continuing to monitor that situation. We partner with several different private and commercial labs to do genome sequencing. CDC continues to do surveillance on samples that we submit to them as well. And so we'll let you know more about that as we find out. As we've told you many times, we don't think that this is a variant that causes worse disease, but it is much easier to spread. And of course, the more people who are infected, the more overall hospitalizations and deaths are going to result. So please remember that we will have enough vaccine for everyone. Everyone who wants a shot is going to be able to get a shot, but we still have a little ways to go until there's enough to go around. In the meantime, you can keep yourself safe and your loved ones safe by following the advice that we've been trying to give for a year now. Please remember to stay home if you can. If you cannot do that, please wear a mask when you go out and stay away from other people. Please try to avoid gatherings of people indoors for long periods of time, especially people from other households. Please remember washing your hands and good sanitation and hygiene. Those things are all more effective than vaccination if you can do them successfully. So please don't forget to do that. On our race and ethnicity data, we're posting that each day on the website, and I encourage you to look at that. We have now given a vaccine to about 12.4% of it has gone to African Americans. Our goal is certainly much higher than that, although that's more than twice the national average. About 54% has gone to white Alabamians. Still about 31% is not reported or is listed as unknown, and so we're still trying very hard to figure out ways to collect that data. Ongoing, I think that unknown number is going to go down. We are requiring that for people to put in, but we still don't always collect that. Alabama as a whole has done a great job. The past 5 weeks we've given out well over 100,000 vaccines, and last week, even with all of the weather delays, it was our second best week that we have had so far in terms of the number of doses that we've given. As of last night, we have about 839,000 doses that have been entered into Imprint by our providers. Interestingly, if you look at CDC's site, they actually have more than that because they're collecting information from these federal programs that are supposed to be reporting to us, but sometimes are a little slow in doing that. So we we know that our numbers are actually a little higher than that. That correlates to about 77% of all the doses in the state have been given so far. To the best of our knowledge, all the remaining doses are scheduled for someone, have someone's name on them. So we're very, very pleased about how we're doing. I think the New York Times had us 45th this week. That's certainly not good enough, but it's ahead of a lot of our neighbor states, and we're very proud of the job that people are doing to get the vaccine out.